The average American over 65 is on at least 4 medications. That's not healthcare, that's a subscription service. And today, my name is Chris Betcher. I'm here with my brother Brett. Welcome into the Rejecting Average podcast. We're going to talk today about how the healthcare system in general is really designed for dependency and what that looks like, how the system is flawed, and some of the things you can do practically in your life to try to distance yourself from that dependency. So, what's going on, Brett?
Hey Chris, how are you?
I'm doing great, man. Yeah, excited to jump in here. I guess let's throw it over to you first of all. We spent a lot of time in the system ourselves. I think I was in it officially out of grad school for 10 years. I think you were in it for 7 or 8. I'd love to hear your experience to kind of kick things off today. And obviously, we can talk a little bit about why we left, but more importantly, kind of I'll start to unpack what is actually going on in the system itself.
Yeah, it was a very mixed feelings regarding, the system itself and my time there. A lot of positives, but certainly a lot of writing on the wall that things were heading in the wrong direction. For me, the biggest drawback was really how the patient was ending up, suffering from really the way that the system was designed. And just to give an example, when you look at actually the number of jobs that have grown over the years, looking at healthcare administrative jobs, for example, compared to like actual clinician or doctors, physical therapists, whatever clinician you're talking about. I mean, it's like 10 to 1 as far as the administrative roles that have grown, and it's just a lot of pencil pushing, a lot of numbers being pushed around, and arguably, it just puts a lot of strain on the doctors because, in a lot of cases, it's these people in administrative roles, not knocking any of them individually, but when you have that many new roles being created for administrative purposes, we're really just in a position where we need to generate more and more revenue to pay for those roles. And, without having that many more doctors coming on board, there's just not that many more actual like billable visits happening. So really the solution is to just drive up, the cost at each visit that's taking place. And, ultimately when you have non-medical people taking over positions like in hospital systems, really they're coming in and they're just looking at numbers, and each patient becomes a number. In home health, I think we saw that where, it really became a numbers game. And the only solution is just to crank out more visits to drive up the cost of each of those, what everything that's billable was kind of being implemented. So it's more interventions, more medications, and at the end of the day, the actual numbers that we're spending on healthcare have never been more, but I would argue the outcomes have never been worse. And we kind of unpack why that is and what that actually looks like, and what to do about it, which is what I'm excited to do on this podcast.
Yeah, I mean, I'm glad you kind of brought up like not just the administrative side of it, but like even now what's going on behind the scenes on like the algorithm side. And like for me personally, like with coming out of the home health side as well, where you'd have somebody that had a stroke and they're in their home, they can't get out of bed, and then you're being told you can see them initially once a week, and then eventually a couple weeks later they're like, well, now you can only see this person every other week, and you're like, this person's never going to get better. Like there's nothing that I can do in 40 or 45 minutes that's actually going to impact them on a massive scale to be able to get them healthy and be able to even do not just the physical stuff that's going to be needed, but then the educational pieces of caregivers and all that. And so, yeah, I mean, it's just this vicious cycle. And then, even going back to what you were saying about the administrative side is like some of that is being driven by the healthcare system itself, but then a lot of it's also being driven by the government because we all know they don't have any money. So if the primary reimburser for healthcare is Medicare and Medicaid, they're creating more and more loopholes that systems have to jump through to be able to get reimbursed. And so then on the backside, the system is having to go ahead and create all these new paper pushers to make sure that they're dotting their I's and they're crossing their T's to be able to get reimbursed. And so it's like on one hand, the government's trying to hold back money, but then what ends up happening is the money that is being given to the systems is just being used for all of these extra administrators. And who ends up suffering is the patient. So just the quality of care just continues to decline and decline and decline. as all of this stuff has to be taken care of, and again, there's certainly some really, really good doctors and clinicians and nurses and PTs that just have the best interest of their patients, but they're just so handcuffed. And I think that's kind of I guess what I'd like to talk about next is just like the handcuffing that's going on inside the system and why there's so many people that like they really feel like they want to make change. I think we were both there as well, where you come in kind of guns blazing, you're excited to be, in the clinic or in the hospital trying to change lives, and then you quickly realize just how limited you are because of that.
Yeah, exactly. And I think for you and I, that showed up as not being able to talk to anybody technically about their nutrition, and being in those homes where you see exactly what they're eating, you see what's on the counter, oftentimes you even see what's in their fridge, and with that you just recognize that, yeah, if you're eating this on a day-to-day basis and you have congestive heart failure, or you have type 2 diabetes, and that's leading to the complications that we're in your home treating you for, at the end of the day, like there's nothing that's going to happen in those visits, as you mentioned, to really drive real results. And that, as you mentioned, is a handcuffed position to be in, because you just can't give adequate care to the best of what you feel like your abilities are, because of the red tape going on. And I would argue, on like the medical doctor side, obviously we're not medical doctors, but I think that I'd be curious to pick some brains there, because what I imagine happens is you're in a position where you can tell someone like diet and exercise so many times, but they're really not able to give, true details to those people. Number one, they don't have time. If you have 7, 10, maybe 15 minutes, are you really going to be able to break down, what those people should be doing to improve their life? So you end up kind of giving, this really broad, not that beneficial advice to the average person who needs, a lot of help and information in those areas. And then at the same time, when you tell people that over and over and they don't take any steps themselves, because there are ultimately a lot of people out there that really have no interest in, bettering their current health or current situation. It's a very comfortable place to be, and kind of just seeking, the next level of comfort. And obviously there's a lot of people who are struggling with their health who do want to improve and who are trying to put that time and energy into it. But yeah, when you tell people over and over and over diet and exercise, and the vast majority are not interested in hearing that, kind of the only tool that you have left in the toolbox is, pharmaceuticals or, prescriptions. And it can become, I imagine, very easy to just sort of skip over the whole diet and exercise piece altogether, knowing that like, hey, this is really what I have to lean on is the pharmaceuticals, because our primary job is to, get your blood pressure under control or control your type 2 diabetes. And, when a lot of people have not made changes for so long, the idea that they're going to just suddenly make those changes is unrealistic. So yeah, it's kind of a chicken or the egg in a lot of regards there. But yeah, I'm curious to kind of hear your opinion on that.
Yeah, and I mean, I think like some of it, you're right. There are people out there that are trying to at least provide some level of nutrition and guidance, and there's a small percentage that probably actually have a clue of what they're talking about. But there is a large number that they have nowhere to start. And you and I have worked with a number of, I think of like the number of cardiologists that we've worked with that didn't know how to take care of their own health personally in terms of nutrition and exercise. And they might be really good at, putting stents in or providing, some level of a new valve transplant, that kind of a thing. But then, when it comes to actually like, losing weight and being able to improve their nutrition and like dial those things in, they've just never been really taught it at any significant level. And certainly if they don't understand it themselves, for them to be able to then provide that information and create real meaningful change in 7 to 10 minutes, it's impossible. It's just not going to happen. And so, yeah, and I think you end up in a situation too where you get some of these clinicians. We were there. We were pretty jaded. You get jaded quickly when you're just spinning your wheels and really trying to keep your head above water, because you've got somebody else coming in every 7 minutes, every 15 minutes, to the point where there is kind of a disconnect even on like the relational side, where years ago, doctors knew your family, they knew your children, and And unfortunately, there's probably many factors that have led to this, but the number of patients that need to be seen per day is certainly creating a lot of that disconnect. And you go into an office where maybe there's 10 primary care physicians, and they're kind of sharing patients in a lot of ways. You're not necessarily going to see the same person over and over again too. So that kind of disconnect from that relationship, I think, has had an effect as well, because you don't really know that person. You don't really know what they're going through. And as a result, you don't really have that human tie to it, because 7 to 10 minutes later, you're not going to see that person, for another year or 6 months or whatever it is. And you're still burdened by the overhead of the paperwork side too, that you've got to, climb this mountain at the end of every workday just to get yourself caught back up so you can do it all over again. I think that's really what burns people out, in my opinion, is just the constant overhead of the paperwork. And I think that's why so many people try to get away from it, but they kind of feel handcuffed at the same time, because the paycheck is consistent. We always called it a golden handcuff, because it does provide, it generally provides a pretty comfortable life. And so to try to distance yourself from that it's terrifying. What am I going to do here? I don't necessarily have any business experience. I've never started something on my own. And so, you continue to come back to the system that provides for you, provides for your family. And, it's also a bit of your identity too. You've spent a lot of time in education, trying to get to this point where you're a nurse practitioner, you're a physical therapist, you're a medical doctor, whatever it is. And to think about having to potentially turn your back on that in some way, it's a very, very tough pill to swallow.
Yeah, I'm glad you brought up the paperwork because, yeah, I think that was a big push for you and I to get away from traditional healthcare. I would argue that if you didn't have to do any paperwork or very little paperwork, the job becomes much more enjoyable. It becomes, I don't want to say easier, but you get to focus your attention in the right areas, which just naturally makes it feel more rewarding. Because, yeah, I mean, we were there where you basically had to pick between actually giving your patient your undivided attention during those visits, and then coming home with hours of paperwork that you'd have to now take time away from your wife and kids. And it's a very difficult position to be put in, because I mean, you could spend your whole weekend doing paperwork if you weren't keeping up with it during the actual visits in some way, shape, or form with your actual patients. So yeah, to be pulled between wanting to engage, wanting to be doing your best to give them at least a good amount of your focus, but like you just had to be documenting things. Even legally, you were supposed to be documenting a lot of things during the visit as opposed to after the visit. But again, that's just taking away from that actual interaction that you're having with them. And yeah, just puts you in a tough spot. And obviously a lot of people feel that, and arguably the patient feels it the most, because when when you go in for a visit and you only have X number of minutes face to face with a provider, and they're filling out paperwork for half of it, I mean, that can be frustrating. You can feel like they're missing things along the way, like they're not actually listening to you. And yeah, it's like a no-win situation, for patient, for provider. But ultimately, yeah, you're just checking those boxes because, as we touched on at the very beginning, all those administrative roles, all the insurance companies, there's so much oversight. And at the end of the day, yeah, it's the patient that suffers along the way. And I mean, going back to, yeah, what you touched on earlier, just an anecdote, it's kind of a sad story, but the idea of, we have, had someone we know who had cancer, and the doctors are kind of out of touch, is I guess what Chris was getting at earlier. The doctors are disconnected. It's not like quite that family doctor anymore. And what I mean by that is, we had a friend who had cancer and basically went in for their annual checkup, after basically having all these visits, all of these things that have gone on over the course of a year since their last annual visit. And the doctor basically walked in, who hadn't seen them for a year, and was like, "Hey, how was your year?" All excited to see them, but not really recognizing that obviously didn't look at their chart, didn't see, all of the history that had gone on, and a lot had changed during that year, with chemo, with surgery, and everything that takes place there. But kind of just an example of, again, a bit of the disconnect, because that provider likely had, 1,000 other people on their schedule that they've had that same conversation with, and just struggling to be able to keep up with all of those new visits, and ultimately not even having time to review charts and do basic things that really should be necessary to provide the best care possible. But kind of just the idea of the healthcare burnout that we felt for a while, and many others are feeling today.
Yeah, and we're going to get into kind of that ability to distance ourselves from the system here in a little bit. But I do want to kind of dig a little bit deeper into just the idea that like preventative health is not nearly as profitable as kind of the Netflix model that we kind of currently have. And what I mean by that, so you think about like Netflix, you pay monthly. You're continuing to pay over and over and over again, and there are so many people in the healthcare, so many entities in the healthcare system that are taking pieces of the pie that if you were to start cutting back on that piece of the pie, it would hurt people that are kind of like pulling the strings around the system here. So they need kind of the security of a sick population and a system that is going to kind of ignore the root cause of things to be able to kind of keep that machine churning. And if you kind of look at a graph on the exponential growth that continues to take place when it comes to our healthcare costs, particularly in America, and you can compare that to really any other country in the world, and just how insane our spending is when it comes to healthcare. And again, that's all because it's driven on having this sick population, and then that sick population just continuing to funnel through the system. And one thing I will say that the system does a very good job of is keeping people alive. And so if I can't tell you how many times I've gone into a home and thought, man, this person is sick. Like they just came out of the hospital. They're not in a good spot. They're not taking care of themselves. They've obviously been sick for a very long time. And you kind of go through the process and get them kind of stable again in their home. Still very, very sick, but at a point where we're basically being told like, hey, we've got to discharge this patient. And then you come back 4 years later, and this person's in exactly the same place. They haven't gotten healthier. They're just as sick, if not sicker, but they're still kicking. And it's actually shocking because that's what the medications allow for. They certainly keep people going, but the quality of life is terrible. People that they literally cannot get out of their house for the last decade of their life, and they just are, existing in front of the television. And so, you think about it, that's a recurring customer over and over and over again. And so, what we like to really shine light on is there's a big difference between quantity of life and quality of life. And it doesn't mean you can't have both, but being around is not necessarily where people want to be for the last 10 or 15 years. They don't want to just exist. They want to be able to thrive as long as you possibly can. And, I know you and I have had this conversation, like have life just fall off a cliff really quick. I want to feel fantastic. And then all of a sudden one day, the last, let's just say last couple months of my life, things get really, really tough and pass from there, as opposed to, just not being able to do the things I want to do, not being able to play with my grandkids and do the things that I enjoy on a day-to-day basis. That's kind of what sucks the joy out of life, and that's something I definitely don't want to experience. So, I guess would like to kind of hear a little bit more on, just your thoughts on kind of that Netflix model, and kind of why that's occurring and what we can continue to do about that.
Yeah, I mean, I think why it's occurring is money talks, and at the end of the day, it's very profitable, as you mentioned, to create a medication, for example, that treats a symptom, as opposed to directly doing something to intervene with the actual what's causing it. So, for example, if we're looking at high blood pressure, there's different reasons that people can have high blood pressure, but kind of broad stroke, in a lot of cases, it's because people have a little bit excess body fat. They're deconditioned cardiovascularly, and in a lot of cases, they have some level of insulin resistance. Which, to make a long story short, you have high insulin levels. Basically, that's causing salt retention, and so it's really that where sodium goes, water goes. So now you have excess pressure within those vessels. And it's not necessarily the salt or the sodium that's the issue. It's more that high insulin or insulin resistance in many cases. And in that case, you'd be prescribed something for high blood pressure. And I'll think back to somebody close to us who went in for borderline high blood pressure. Did they actually need a medication? Maybe, maybe not. Were there other things they could have done to address it? Doing a little bit more exercise, doing specifically eating a little bit better and dropping some weight. But anyway, they get on this blood pressure medication, and suddenly they start having this bad cough. And you're not really sure where that came from. Are they sick? Are they not? And then to find out that it is actually a side effect of the high blood pressure medication. Now, the big problem was they were coughing so much they actually developed a hernia. Now they need hernia surgery. So you go from having borderline high blood pressure, and maybe you should just clean up your diet. But again, the first line of defense in a lot of cases in the medical field is a pharmaceutical. And unfortunately, every pharmaceutical, every drug has some level of side effects. Even the best drugs out there have some side effect when, depending on the individual, depending on the dosage, how much is taken. And even supplements out there that are very benign and considered very safe, there's always some level of small side effect with them. So when we get into the pharmaceuticals, you should always be kind of aware of what those side effects are. And unfortunately, I do think the more times that they're prescribed, the more kind of routine it becomes, you sort of start brushing over, what those side effects are. So like you're looking at this, this bottle for a high blood pressure medication that's prescribed millions of times. And if you look at the side effects, it does mention something like coughing within that. But again, because it's kind of seems benign, it's not even really talked about or mentioned, but ultimately led, I would argue, to this person needing hernia surgery and kind of kicking off a cascade of health issues alongside of that. So, I guess, it's a pretty good example of how that prescription model can really help. If you think of you are the medical system, what do you want? You want somebody coming in, paying for a medication that's potentially leading to other medications down the line, other visits. And as you mentioned, keeping them alive, but not necessarily allowing them to thrive in any way. And that's you hit it on the head. The idea of you can do a lot of things really well or a lot of things poorly, and to be honest, it's probably not going to affect your actual longevity by more than 5, maybe 10 years. Even drastic health changes, we're probably not looking at significant changes to your longevity. But the quality of those years are going to look drastically different for the person who's, consistently exercising, eating right, taking care of themselves, maintaining a lean body composition versus, the person who's kind of letting themselves go, not really worrying about any type of nutrition, not worrying about, how much they drink, smoke, all of those things. I mean, you're just not going to be able to do any of the things that you love. Genetics are going to play a huge role in ultimately how many years you live, but what those years actually look like, much of that is really up to us, up to our habits and kind of what we do on a day-to-day basis. And arguably that kind of starts now.
Yeah, and again, you can see the fire. I like to think of the body being it's very resistant. We can literally damage ourselves for years and years and years, and it can keep kind of those flames at bay. And a lot of people think, oh, I turned 40 and then the wheels fell off. But if you were to look back on, what they were doing in their 20s and 30s, they were kind of they were letting things go for a long, long time. And so the body's able to withstand it for 20, 30, 40, 50 years in some cases of neglect. But what is so cool about it is, and we see this all the time, of someone could have been on a terrible path for 25 years, and within 3, 4, 5, 6 months of meaningful change to their diet, to their activity level, their sleep, they're just in a completely different stratosphere with their overall health. So, it can kind of shake things off for a long time and put those fires out. But on the flip side of that is once you start to actually make those changes, your body can also kind of recover in a very quick fashion and kind of cycle through some of those, those old cells and some of those things that were really holding us back in terms of insulin resistance, like you talked about earlier, and, inflammation levels and things like that. It's like, it's pretty amazing how we're designed and how when we give it the right inputs, it can really take off in a positive way, almost regardless of age. And, we've seen that with people in their 70s and even 80s who are, fearful of getting in the gym. They start getting in the gym and they're like, wow, I feel stronger now than I was in my 50s. And it's like, that's all it takes is those consistent inputs and letting those things continue to fuel yourself. And, I guess kind of going back to the system side of things, it's like, if we were to just address root causes and do that in a positive way, you wouldn't have those recurring patients. And so, yeah, I hate to say it, but it does really come down to the money aspect of it and, kind of being able to monetize each and every person that walks into the clinic. I don't believe that's the goal of the doctors. I don't believe that's the goal of most of the clinicians, but it's just the way that the cogs of the system are designed. And it's really, really difficult for someone in that system to kind of ruffle enough feathers to create meaningful change. And so, I think what we've realized, and you're seeing this kind of longevity focused and, holistic model that's kind of growing and growing, is that people are starting to kind of jump out of the system and, they're kind of keeping some very, very minimal catastrophic things in place in the event that they had a car accident or whatever. And everything else is being poured into, how can I take care of myself because I no longer trust the system to do it for me. And I just want to kind of make one more quick point on the kind of the way that the medication side of it is organized. And, when you think about if you're someone who's got, let's just say you've had a blood pressure issue, you probably have a cardiologist, you probably have your primary care, you may even have 2 or 3 other doctors. And as a result, all of those doctors are trying their best to help you, but they also are kind of treading lightly on what the other persons are doing. Like if your heart doctor is prescribed a blood pressure medication, and maybe a cholesterol medication or a host of other things, and your primary care, you go in there and you're like, hey, I'm not really sure I need to be taking this anymore. I'm kind of starting to make some of these changes. Most of the time, they're going to be reluctant to do that because they weren't the physician that prescribed in the first place. And you kind of see that all the time of, it's much easier for them to add to the list than it is for them to be able to subtract from the list when you have multiple kind of specialists in the process. And, it's, again, as busy as they are, their ability to communicate effectively amongst themselves, it's very challenging. And I think that a lot of them do the best that they can with it, but it's just, you only have so much time in the day. And when you've got to be able to see this many people, are you really going to be able to call up that other doctor and have that conversation on a regular basis to figure out, hey, can I take this guy off this or not? Even though he's presenting this way. And so it just gets very difficult. It's easier to just keep him on it, let it ride. It's probably not hurting anything, or, and maybe it is, but we don't really know what's a side effect and what's not anymore. It's just the way that patient is presenting. So it's that's a very tricky thing. I believe once the kind of the cascade of medications start to kind of ramp up.
Yeah, and as you mentioned, I think another important point is the idea that I don't have a percentage, but a large percentage of people really don't have any interest in going any other way than the pharmaceutical. So because of that, you just recognize that, from the doctor's perspective, they are going to kind of just naturally gravitate that direction. And at the same time, like, hey, if you're listening to this, like, I have a feeling you are in the other camp where you probably had a position where you are in the minority, you are quote unquote rejecting average, and you're kind of not fitting in with what the crowd is doing around their health. And I think that's a really good thing. So, but recognizing that, like, I would argue the healthcare system is set up for the very average, like, sick person who doesn't really care what they're trying to do with their health. They just want to be kept alive. Kind of that example that you gave before. And yeah, just recognizing that, like, if you want something more, you probably do need to look at, some other alternatives, whether that's like arguably, like your doctor is not meant to be, your trainer or your nutritionist or your everything else. They're kind of meant to see what's going on, what's gone wrong, and steer it back in the right direction with, something quick. And a lot of times, again, that's more of a pharmaceutical or a medication. So, recognizing like you just have to take the bull by the horns and be your own advocate, and kind of look for your own solutions to the problem. Because yeah, if you're truly looking to address root causes, sadly, I don't think, within the confines of the medical field is the place for that. And that doesn't mean that there's no role for, for these doctors. It doesn't mean there's no role for a lot of like the mainstream medicine or mainstream, even like pharmaceutical approaches. Chris and I aren't anti any pharmaceuticals in the right setting. But arguably the problem is that there should always be some level of exit ramp available to you. And maybe that takes you, 6 months or a year to be able to get your health in order, to be able to, take that off ramp from a medication. But, to just be put on a medication without like any idea of what you need to be doing to be able to get off of it. And then, yeah, the next thing you know, you have 3, 4, 5, 6 medications. That's a dangerous place to be because, actually polypharmacy is one of the top causes of death. It's like fourth or fifth cause of death, which just basically means people are taking so many medications that they end up, either overdosing on one, or there's interactions between those medications that again cause these side effect cascades, ultimately leading to a cause of death. So again, not like fear mongering or anything here, but just the idea that if you're not educating yourself and being your own educated consumer, yeah, you really are kind of leaving things up to chance in a system that's very overwhelmed right now. And arguably, yeah, you're not going to be getting, ultimately the best care possible, unless you have questions. You can go in and kind of have your own conversation. If you kind of just go in like a sponge and try to soak things up, there's just not going to be, enough feedback for you, because there's only so many times and so many hours in a day for all the visits that have to take place. But I guess, yeah, with that, I mean, we start talking about like alternative paths or, branching out, kind of doing your own thing. I mean, Chris, what kind of advice do you have for people? What are some different options that you would say, hey, here's some things that might work for you, or, just some different paths in regards to kind of avoiding the sick care system, so to speak.
Yeah, I mean, I guess if you're in a position where the medication side of things is already, the conversation is being had with the doctor, is have that conversation. Like I think it can't just be like, here's your med, take it. It has to be like, why am I taking this? What am I taking this for? What can I do to be able to, like, what meaningful changes can I make in my life to get off of this thing? I think that's like the first step, is just being able to figure out, again, what that off ramp is, as you said earlier. And then just becoming that, educated consumer. So you should understand like your basic labs. Like there are basic things that from a metabolic health standpoint, and, looking at understanding like from a cholesterol side of like, we'll at some point unpack cholesterol a little bit deeper, but, like basic things of like how your triglyceride level, your HDL level, like that ratio is a big deal. Like, being able to, understand what those two things are, that, having your HDL be high, your triglycerides being as low as possible, and the lower that ratio is, the better. Like that's a simple thing to be able to take a look at and understand. And yeah, like something as simple as your fasting insulin, and why that's important, why you should understand it, because it is such a driving force for metabolic issues, whether you're, thinking you're fine, even if you're not pre-diabetic or diabetic, you still could have some level of metabolic issue that's causing some problems. And so, again, we'll spend a lot of time going forward here on further future podcasts, kind of unpacking some of this stuff in greater detail. But I think understanding basic lab work, and then even from the standpoint of like basic functional tests that you can do to kind of assess where you are, like, how many times can I get up from the chair in a minute? Oh, I can't even get up without using my hands one time. Like we've got to be able to improve on that. That's something that is a clear indicator of risk. And, when you use these functional tests, you can kind of use them as a bit of a carrot for yourself. How far can I walk or walk run in 12 minutes? They call it a Cooper test. It's a really simple thing that people can do at the house to kind of get an idea of like where your VO2 max is. And again, those are all things that, along with lab work, are kind of tangible ways to kind of get a baseline of where my health is at. And I think that's kind of what I was trying to get at, is like you have to establish where your baseline of health is right now, because now you have some opportunities to be able to figure out, where do I stand? Am I really, really in bad shape here? Or, where are there areas that I can do some small things, and then, 3 months later, 4 months later, 6 months later, recheck, or even, with some of these functional tests, you could do it monthly and kind of see what kind of progress you're making. So I think that's a big deal, is we kind of have to be honest with ourselves with where our health is at. And most people kick the can down the road way too long. And as a result, then they're almost left with no choice of, the doctor says I'm in pretty bad shape. If I don't do something about it, he said I'm going to have a heart attack. So I guess I got to take these 3 medications. It's like, let's get ahead of that. And, even if you are in that situation, it doesn't mean it's the end of the road. It doesn't mean you can't make some changes with your habits to put yourself in a position where, yeah, you actually have the opportunity to be able to get off of those meds going forward. So I think that's where I'd start, is, advocating, becoming an educated consumer, and then getting a baseline for where your health is at, so you can start figuring out, where can I go from here?
Yeah, I totally agree. And I would also just say, like, if you are a little bit jaded about the current healthcare system, I think that you can use that to your advantage to, basically, like, hey, I'm going to try to spend as little money as I have to within this system. And that can work in a few different ways. Number one, obviously getting yourself in a position of thriving health means, hey, you don't need to be, going to the doctor every other month for different things. You don't need, different medications for different things. So I think just taking care of yourself, it's, really broad advice, but like, that's first and foremost to me is, if you don't trust the system, then you should be doing everything you can to not end up becoming reliant on it long term. So that's one. And then I guess the other aspect of things would be, we touched on a little bit on the idea of insurance companies, which could definitely be its own entire show here. But at the end of the day, I think insurance is a huge issue. It's more expensive than ever. They never cover, half the stuff. You end up paying out of pocket or a huge deductible regardless. Something that I think that's worked really well for both of us is the idea. This is, again, assuming that you're a pretty healthy person without any pre-existing conditions. But something like Crowd Health, it's a crowd sharing health sharing plan. So it's not considered traditional insurance, but it does act in a very similar way. And I guess I can speak for myself. I can't necessarily speak directly for you, Chris, but I know you've seen similar results. It's saving us thousands of dollars a year on health insurance. And really the idea that we pay less for a premium, we have, a lower, what they would call a deductible. It's not technically called a deductible within this plan, but basically lower deductible, lower premium. And we get the freedom to essentially go and get these visits done wherever we want. We don't have to worry about it fitting within, a certain provider or a certain plan. And then at the end of the day, they'll just reimburse us still for preventative visits. So even though we're paying less, we still get, some of these prevention. My son has his annual appointments, things like that. Daughter, same thing. She goes in for her annual visits, and they cover that up to $300 for a single visit. And so I think something like that is health share plans in general are worth looking into for a lot of people who are kind of looking for more of that catastrophic coverage, as you were touching on earlier, where you still are covered if, again, there's something serious that goes wrong, but you don't feel like you just have to be shelling out of pocket, thousands of dollars a month when you're not really using the services or you're not really going to the doctor anyway. You're basically just paying for other people to go regularly. When that's basically how insurance is working is, if you're not using it, then you're paying for all the other people who are not taking care of themselves and who are going all the time. So personally for me, again, I'm trying to spend as little money as I need to on those things while still having that catastrophic coverage. And something like Crowd Health has been really beneficial for us in that.
Yeah, I'm 100% with you on that. It easily saves us probably $8,000 to $10,000 a year. That sounds like a crazy number, but it's when you're talking about a a family, any kind of a family plan, it adds up very, very quickly. So yeah, I would 100% agree with that. I'll drop the link below. There's I think they've actually got a special going right now too, where if you use the link, they'll be able to, I think it's like $400 that you save over the course of the first 3 months. So take a look at that. Would definitely advocate that, whether you go with Crowd Health, whether you go with a different health share plan. Easy way to save thousands of dollars a year if you take care of your basic health. So yeah, I think this is a great conversation, Brett. I think we'll kind of wrap it up there. We'll dig deeper on this here, I'm sure, in future podcasts. But yeah, I think in general, just kind of to recap, advocate for yourself, understand what you're taking, try to get that baseline, and yeah, try to find ways to hopefully feed the system as little of your dollars and your hard-earned money as possible. So appreciate you guys jumping on here this evening, and we'll look forward to doing it again on the Rejecting Average podcast.